So I wanted to take a few minutes to talk about what you should be cleaning your wound with. If you have an incision, if it's closed, you should be pretty good to clean it in the shower as long as it's closed. Let that soapy water rinse right off of you. It's really important that you keep the rest of your body clean so that you're not just having bacteria build up on the surface of your skin. You want to keep your skin clean. And that includes keeping that incision clean. So I wouldn't scrub the incision necessarily, but let the water run over it, let the soap run over it, let a few minutes of water just run over your body so that all the soap is getting off. Soap itself can be kind of cytotoxic or drying to the skin, so be careful, especially if you're using like an antimicrobial soap like Dial or something like that. You want to make sure that you're letting the water rinse off the skin. So you can do that as long as your incision is closed. You'll let it air dry, pretty much like pat it a little bit. Make sure you're always using a clean towel, or every time make sure you're using something clean to pat it off. You're not like sharing towels with people or just reusing the same one over and over again. Make sure that you keep that incision clean and dry. A closed incision is one that we typically want to keep fairly dry. So while it's still a little scabby and new, so like in the first 2 weeks, we tend to keep things dry. You may be reinforcing it with some steri strips or paper tape, which is fine. Again, you're going to be following your doctor's recommendations. You can always reach out to the office where you had your surgery and get input on that specifically from the one who probably knows you best. So follow those recommendations first. Clean and dry, keeping that incision clean and dry. So if you have a wound where the incision has now opened and now you need to be worrying about what to put on that bad boy, if it is fairly pink and clean looking, it's just that it's open, you're probably fine with a normal saline, something pH balance, some kind of a wound cleanser. Like a lot of them come in these like spray kind of things, which are great. Makes it really super easy. You're not like having to worry too much about cross-contamination or infecting other areas. So something like that is going to be good in a spray bottle. I can put up a how to make your own home saline solution in the comments below, but you can purchase it, which is fine, or you can make it. It's fairly easy. I'll put a description on how to make that below. So that is if you have something that does not appear to be infected. Your first line should be using just a normal saline or a pH balanced wound cleanser is going to be where you're going to go. Now, if you start to have signs and symptoms of infection, number one, get it treated. So treating things topically is fantastic. You want to get rid of that surface bacteria, but we also want to make sure that it isn't going into deeper tissues. So if you start to show signs of an infection, like, and you're also starting to have some systemic signs like fever, not feeling well, redness that is kind of outside of that first centimeter or inch or two from the wound, if it starts looking more like you're dealing with a larger infection or a cellulitis or something like that, you need to get medically treated. So you should seek help from your physician or your primary care practitioner or urgent care. Usually something like that. Hopefully you don't need to go to the ER. You want to use these other channels first. But if it's bad or it's recurrent, then probably you need to get to the emergency room. So look at your situation in particular and act accordingly. But if we're talking about something that's infected, treating it topically as well as with medication and IV if necessary is going to be great. The problem happens with, I think a lot of times, shopping from like the aisles in the store, and then also kind of those old wives' tale-y type things that we've kind of just adopted from when we were little. That may not be so true right today. As we learn and grow, these things change. So some things you want to avoid using when you are dealing with an open wound is rubbing alcohol. Rubbing alcohol is going to be very cytotoxic and drying. It's going to actually create some more problems. Same thing with hydrogen peroxide. Unless your wound has like a lot of debris in it, like a road rash situation, or you like fell in the dirt or something, that effervescence really does not improve the wound healing. I know when I was little, I probably had my knee scrapes washed out several times with hydrogen peroxide, but I also have these scars and scabs and things, or I had a lot of scabs and a lot of scarring, probably from using these old school remedies. So rubbing alcohol we're not going to use in our open wounds. We're going to stop using the hydrogen peroxide in our wound. Betadine is really meant for like antiseptic, pre-surgical, cleaning the surface of the skin, removing all bacteria. So we do not want to be using these things inside an open wound. That brand new skin is super fragile. Anything we do could potentially cause damage to it. Is only going to mean that your wound is going to stay open longer. That is not what we're going for. We're going for a wound that heals as fast as possible so we get the best looking scar. So do not use those things. No hydrogen peroxide, no rubbing alcohol, no betadine. If you do have an active infection, then you want to get treated with antibiotics, whether it's oral or IV as needed. And then there are some topical antimicrobial cleansers that you may want to use. But the idea with a lot of these are that you're using them for a short period of time, and then you are switching back to something like a saline or the pH balance type cleanser. So I always suggest that people look at the label, actually read the label of the thing that you're using. Look for the words antiseptic. If you're using an antiseptic and you have no signs and symptoms of infection, then you're using the wrong thing and you should stop using that. It's going to cause more harm than good. If you have an infection and you're using something like that, go for maybe like 2 weeks with it and see. If it starts to improve, then it's time to get off that antiseptic and get back onto a cleanser. So you always need to take account of how things are looking right now, because as things progress, things are going to change. You are very rarely going to use the same products through the entire life cycle of your wound. You want to use what's appropriate at each little time. So you are going to have quite a few different products that are going to be in the life cycle of your wound. If you need any support, you can feel free to reach out. You can reach out wherever you're seeing this video. You can also find me online, Facebook and Instagram as Better Wounds. You can find me on our website at betterwounds.com. If you need any input on your wound, you could send me a picture through either DM, a private message, or on that website you can send a picture through the link, the help button that pops up. So feel free to reach out if you need any support. We do online video consultations. We have education. Reach out and let us know what you need help with or what you need to learn more about. I hope you're good. I hope you're healing. Hope all's well.